There's something strangely satisfying about it, almost hypnotic, even if it feels a little gross to admit. Watching that fine layer come off the skin, seeing everything instantly look smoother, cleaner, brighter. Dermaplaning has exploded in popularity, especially over the last year, and I constantly hear questions from patients and followers asking whether it's actually worth doing or if it's just another beauty trend. Today, we're breaking it all down so you can decide for yourself if this treatment makes sense for your skin. I'm Dr. Sam Ellis, a board-certified dermatologist, and my goal is to help you truly understand your skin and choose products and treatments that actually work. The first thing we need to clear up is what dermaplaning really is, because the term gets used in a very broad way. In reality, people are usually talking about one of two different techniques. One is done at home, typically with a small facial razor, and focuses on shaving the face. For clarity, I'll refer to that as face shaving. The other is a professional procedure performed in a medical or clinical setting using a sterile surgical blade, and that's what I'll call dermaplaning. Both methods exfoliate the skin and remove vellus hair, which is that soft peach fuzz you see on the face, along with some thicker unwanted hairs. The difference is that in-office dermaplaning can go slightly deeper, removing more of the top layer of dead skin cells than at-home shaving usually does. The benefits are pretty straightforward and very real. These treatments remove facial hair, including those fine baby hairs that catch the light. They leave the skin incredibly smooth, almost unrealistically soft. Makeup applies more evenly and looks better throughout the day. And because you're removing dead skin cells, the complexion often appears brighter and more refreshed. That glow people talk about isn't imaginary, but it's also important to understand what dermaplaning does not do. Professional dermaplaning is performed with a sterile blade, and who is allowed to perform it depends on state regulations. In many medical offices, a trained medical esthetician will do the procedure, while in other states, only nurses or physicians are permitted. When people ask whether I recommend dermaplaning, I usually explain that I see it similarly to something like a massage. For some people, it becomes a favorite self-care treatment they never want to give up because they love how it makes their skin look and feel. For others, it's completely optional. You can absolutely have healthy, glowing, well-exfoliated skin without ever dermaplaning. It's a preference, not a requirement, but it can be a really nice addition. Most skin types tolerate dermaplaning well, but there are important exceptions. If your skin is compromised in any way, meaning you have an active infection, an open wound, a sunburn, active acne, or a rosacea flare, this is not the time for dermaplaning. The risk of irritation and infection is simply higher. A qualified professional should always evaluate whether you're a good candidate. For those who do it regularly, treatments are usually spaced about 4 to 6 weeks apart. That timing aligns with how long it takes dead skin cells and peach fuzz to build back up. One thing I want to be very clear about is the claims surrounding dermaplaning. You'll often hear that it stimulates collagen, improves product absorption, reduces wrinkles, or treats acne. While those ideas sound appealing, we don't have solid clinical data to prove them. I don't promise benefits that science hasn't confirmed. That said, there are still meaningful, visible advantages, and understanding the difference helps set realistic expectations. Now, since professional treatments aren't feasible for everyone, let's talk about what you can safely do at home, because this is where many people start experimenting, sometimes without enough guidance. At home, what most people are really doing is face shaving, and when done correctly, it can provide some of the same surface-level benefits as dermaplaning. The most common tool is a simple eyebrow razor, which makes this a very affordable option. If you want something more advanced, there are devices like dermaplaning tools that combine vibration with a blade for a slightly more refined experience. What's important to understand is that this technique does not involve multi-blade razors like the ones used for legs or beards. Those are unnecessary here and tend to cause more irritation than benefit because the goal is gentle hair removal and light exfoliation, not aggressive shaving. I personally love face shaving. It makes makeup sit beautifully, gives products a smoother canvas, and in certain lighting, especially in the summer, it eliminates that fuzzy sheen peach fuzz can create. I've walked countless friends through how to do this properly because it's one of those skills people aren't really taught. However, just like professional dermaplaning, it's not for everyone. If you have active acne, flaring rosacea, very sensitive skin, or any compromised areas, this technique can do more harm than good. If you're going to do it, technique matters. Always start with a clean, fresh blade. iGround razors are inexpensive and meant to be disposable, so using a new one each time is ideal. Some tools are designed so each blade lasts a few sessions, which can also work well if they're properly guarded. Before you begin, your skin needs to be completely clean and dry. Some people simply wash their face, while others go a step further to remove any residue. Personally, I clean my skin thoroughly and make sure it's dry so the blade glides evenly. If certain prep steps feel too harsh for your skin, skip them. This should never feel aggressive. When shaving, hold the blade at about a 45-degree angle and pull the skin taut. That tension is key. Shaving loose skin increases the risk of irritation and nicks. Use short, light, feathery strokes, moving downward in the direction of hair growth. Avoid shaving upward against the grain at home, as that increases irritation. You shouldn't need to press hard at all. If you feel like you're forcing the blade, that's a sign you're using too much pressure. I prefer doing this at night, so I don't have to immediately apply sunscreen or makeup. Your skin is fresh afterward, almost like baby skin, and it's a great time to nourish it. This is also when certain active ingredients can be especially effective as long as your skin tolerates them. Gentle exfoliating acids can work beautifully here, helping prevent small breakouts and maintaining smoothness. After applying any actives that work for you, always follow with a moisturizer and let your skin rest. Sleep gives your skin time to recover. In the days that follow, sunscreen becomes non-negotiable. You've removed protective dead skin cells, which makes your skin more vulnerable to UV damage. Skipping sun protection after shaving or dermaplaning can undo all the benefits and lead to pigmentation issues. Before finishing, there's one question that always comes up, and it's important to address it clearly because the myth refuses to die. People constantly ask whether shaving the face or dermaplaning causes hair to grow back thicker or darker, and the answer is no. If that were true, bald men would have solved hair loss long ago by shaving constantly. Hair growth is controlled deep in the follicle, far below the skin's surface. Shaving has no impact on that process whatsoever. The reason hair can appear thicker after shaving is simply because you're cutting it at its widest point, leaving a blunt edge instead of a tapered one. That visual illusion can be convincing, but biologically, nothing has changed. Understanding this removes a lot of unnecessary fear. Dermaplaning and face shaving don't alter your hair growth cycle. They don't make hair coarser, and they don't cause long-term changes. When done correctly and on appropriate skin types, they're safe cosmetic practices. Like any skincare step, they're not mandatory, but they can be incredibly satisfying and effective when used thoughtfully. If you've tried dermaplaning or face shaving, especially at home, your experience matters. Tools, technique, and skin type all play a role in how successful it feels. I always encourage people to pay attention to how their skin responds rather than blindly following trends. What works beautifully for one person may not be ideal for another, and that's okay. At the end of the day, dermaplaning is about understanding your skin and making informed choices. It's not a miracle cure, and it doesn't replace a solid skincare routine, but it can enhance results when used appropriately. If you've been curious about it, now you have the information you need to decide whether it's something you want to try or skip. If this helped you understand dermaplaning more clearly, make sure to like the video and subscribe so you don't miss future breakdowns like this. And if you have your own techniques, favorite tools, or questions, share them in the comments. I love hearing what works for you. Thanks for being here, and I'll see you next time.